realized how much we can change everything in someone's body, not just gut health, by optimizing their gut, right? Their hormones, their thyroid, their nutrition, their skin. It just doesn't really, their brain health.
Hey guys, thanks so much for tuning in to the First Optimal Podcast. We're really, really excited. We have Katie Morra on today. She is an expert in all things gut health related. So definitely a treat today. And I always like to try to stress this at the end, but I'm going to stress at the beginning too, is like shoot your questions in, go in the comments, engage with us, email, DMs, comments. We'll be happy to try to work with Katie to get some of those answers, or we'll parse through her information that she shares today and respond to you. But Katie, thanks so much for joining us today. Appreciate having you.
Thank you so much for having me. I love this.
Good stuff. So we're talking all things gut today. So exciting topics.
I know.
You know, it's one of those things that's like really trending out there, and there's a mixture of people. And I think I'm going to give everyone the benefit of the doubt, say they're all well-intentioned, but there's a mixture of like actual gut health experts, credentialed practitioners, in depth. And then there's people that, I think they're well-intentioned, but they're really, really good at content, maybe not so much experts on the proven data, the scientific literature, and or practitioners with the application. And so I think for the audience out there, the reason why I wanted to have you on was a lot of your background, practical experience, and some of those things. So I wonder if you could just walk us through first a brief introduction. Tell us a little bit about how you got started in gut health and a little bit about your expertise that kind of led you through that journey today.
Sure. I will say it's kind of one of those things, in my opinion. It's like you don't know what you don't know when you get started, and we think we know everything, but there's just a whole space out there, which we'll dive into today, of things that I hope more and more practitioners realize they need to have under their belt. So my background, I actually have originally a degree in psychology and biology, and then I went back to school to become a registered dietitian, get my master's in nutrition, because I just found it really, really interesting how much we can change the body and kind of, optimize from that stance and combining psychology with it. And then I went back for the Institute for Functional Medicine, which, if nobody knows or is familiar with that, it's sort of like I always say it's like the governing body, kind of like the peak of, functional medicine education that is out there right now, and kind of originally. And so when I went back, I kind of went into the dietetic path knowing I always wanted to do functional medicine. It was never going to be this traditional space, even though I was being trained as such. And when I went to IFM, one of my first modules was gut, right? And it was like every light bulb went off in my head as I sat there, and everything I learned from the prior 6 years, was going off, being like, oh, wow, it was like domino effect. Everything's making sense. Everything in the body is like connecting for me, and things in ways that never made sense prior in all of the education and years I had in clinical experience. And I just knew in that moment, like, this is what I want to do. It wasn't really an epiphany for me so much as my own GI struggles. A lot of people get into their niche because of their struggles. I definitely had my own share of health issues, but
Sure.
Mine was more, I just realized how much we can change everything in someone's body, not just gut health, by optimizing their gut, right? Their hormones, their thyroid, their nutrition, their skin. It just doesn't really, their brain health. So I really dove down there, and was fortunate enough to come into a clinical practice under insurance where I used to work, where I got to work with thousands of patients, which is very rare, right? Working with 10 plus functional people per day in the functional space is very cash based. So I got that under my belt, and I got to really develop tried and true protocols and experiences, and learn the depth of functional testing. And here I am now, many years later, on my own.
No, that's awesome. And I do want to point out something for everybody out there that did not say at the beginning too, is like, Katie is, so physicians are hiring Katie for her, not only she have amazing on-demand courses, but additional training and coaching she does. So she's respected in that industry. And so I know our medical folks out there, not only are they super busy, but they are very well educated. So often they can kind of, you have to pass the sniff test, if you will, and they can be very challenging to maybe have someone who doesn't have a medical degree per se, a fellow MD, if you will, training them or teaching them something. So can you walk through just how did you get into that space and
Yeah.
like how, what does that look like in your world?
Sure. So I have a online, platform called GHT Academy. So my business is Gut Honest Truth, and we, back in that practice I was talking about where I worked earlier in my career, I started being the one that everyone was coming to. Every MD, physician assistant, NP, they're all coming to me to learn more about the gut. Right. I kind of took on that role, and I realized how much. First of all, our medical system didn't even know. You would think they were kind of the people you'd be going to, and also how much I love teaching. So
Mhm.
I, over the years, took on more and more people and kind of grew that in my own business until I woke up kind of one morning, had a cup of coffee, and my husband was like, I think that you should start some kind of online training platform. GHT was born the kind of next day. And yeah, we do everything from, we started with live courses and like kind of, we call them cohorts. So they're 6
Okay.
month programs. But now we do everything from private mentoring, where we sit one-on-one, whether it's clinical or business. We do on-demand coursework from mini trainings and lab and protocol guides that are super detailed and amazing, in my opinion. They're like the things I wish I had when I first started, handed to me on a
Sure.
silver platter, right? To these kind of 6 to 12-month programs where we teach you everything from lab interpretation to actual practical application. Because what I see missing in the field is that you can take so many courses, but that practical application, even from the best curriculums, is always missing. It's always very fluff filled, and we don't get down to the nitty gritty, which is really how we make people well. So that is really what GHT Academy focuses on and helps our practitioners get to.
Well, no, I think it's awesome because there's definitely a lot of great, really good practitioners out there and good
Yes.
information, but there's a whole nother level to understanding. And for people out there that are looking for people to work with their gut health, like if they are an educator, I heard it. I might get this college wrong. I had a buddy who went to for fun. He went back for his PhD in atomic physics, and I believe
For
it was,
fun.
yeah, yeah, which is kind of funny. It's a whole nother side bar that I'll get off to because he's just one of those awkwardly smart people.
Yeah.
Super nice guy, but super awkwardly smart. Why he's friends with me, God only knows. But so I believe it was Stanford. But anyways, part of the PhD program is they had to take atomic physics and teach it to kindergartners. And
Mhm.
how well they comprehend it was like part of this exercise in their PhD or whatever. And I thought that's brilliant.
Yeah.
What's my point of bringing that up is someone interacting with yourself or
Mhm.
your team, having that level to break it down so they understand
Yeah.
it. Someone who's not an expert coming into this. And I think there's a higher level, and
Mhm.
tell me if you agree with this, but a higher level of compliance and effectiveness once they understand the why of
Yes.
the protocol. Do you see that come through with you?
Yes, I see it both for practitioners and for clients, right? Like if we're talking at any level, most people aren't good educators, right? They
Mhm,
aren't. They
right.
can't break down those complicated topics like your friend and teach them in a way that people actually, right, that connects the dots and then they can do, right, or implement for people or themselves. So that's really, really important. Even when you're finding a practitioner for yourself, right? Is can I actually have them or myself break things down for people so that they can actually make things make sense, right?
Yeah, I heard it once. It was in a different industry, but it's like find somebody who has the heart of a teacher. And I've always
Yeah.
followed that advice, like whether it was an attorney, financial
Mhm.
planning, a
Yeah.
trainer, a coach,
Yes.
business coach, whatever it
Yes.
is. Like, do they have the heart of a teacher? Because then
Love it.
you don't just get the do A, do B, get C. It's like here's why you do A and B and C. So
Yeah.
then it's like it's in you, right? So
Yeah.
well, cool. I wanted to get into a bunch of stuff. Gosh, there's so much. So feel free to slap me back in line if I get us off track here because I just got just a boatload of questions.
All right.
Um, so there's a saying out there, right? A lot of people are talk about like gut health.
Mhm.
Sometimes they just associate it with like digestion, and I'm
Okay.
wondering, can you just unpack like this broad term of gut health? Like, what would fall, and you might even miss some, 'cause I'm sure there's a lot, but like, what would fall under that umbrella of like gut health? What should people be thinking and associating with that when they're thinking of their gut health?
Yeah, so I really think we know nothing, honestly, about the gut at this point. I think you're going to see so much research and like information coming out over the next 1 to 2 decades. Um, I always think of, right, the gut really is going almost brain, but mouth to anus, right? So sexy words, but mouth to anus. Like we're not just talking, oh, my stomach hurts. We're talking about everything from our chewing and our oral health, right, to like what we actually see come out in the toilet. So the thing we don't realize when we're talking about, oh, I think my gut's fine, right, as patients and kind of lay people, the my gut, I don't have GI issues. Well,
Mm,
we don't really know that till we actually dive into the actual makeup of your microbiome and how well you're digesting and utilizing food and what's getting into your cells. And it can affect everything from like cognitive function to, what we call brain fog, to our energy for sure. Because, right, if we're not able to actually digest and use our nutrients from the food you're so intentionally going out to eat and, spend money on and energy, you're not going to
right.
actually get the nutrients that you need to function with high energy throughout the day. It's going to impact things like your sex hormones, right? There's things called the estrobolome and the testobolome that are going to actually impact your sex hormones, whether you're male or female, right? Things like thyroid health. A good portion of our gut function essentially converts our thyroid hormones so that they can be active and we can have healthy metabolism, healthy energy, and all the other things that go with that. Skin health, right?
Mhm.
Mirror of internal health, right? We look at our gut and that often reflects on our skin. Pain, there's a big connection between intestinal permeability or leaky gut and do people have like joint pain, stiffness,
Yeah.
all of that. So you could really take any topic, any symptom someone has and say, I'm wondering if we need to be actually thinking about looking at their gut, right? Immune dysfunction. I was just looking at some lab work right before we jumped on and looking at things like low alkaline phosphatase and low, white blood cells and eosinophils and being like, I'm wondering if this person actually has a gut imbalance leading to micronutrient deficiencies that's actually dropping their immune function.
Mm,
But our general doctors and medical system don't think that deeply. They
right.
do what they need to do in ruling out
Sure.
very severe conditions, but
Right.
so kind of to get on and off topic, it can be everything and anything all at once, which is kind of amazing and overwhelming to think
Yeah, I
about.
mean, several great points there. I think one of the things I see a lot with I see it more with men, I think, and maybe it's just because of some of the training I do.
Mhm.
Uh, I do some things s some may argue I shouldn't do in my stage in life, but whatever. I get pretty banged up, and a lot of the guys will come in like, "Hey, can I do a recovery protocol? Can I do this? Can I do
Mhm.
that?" And then I'm like, "Well, let's look at your gut health. Let's look at your
Yeah,
inflammatory markers." And they're like, "What?" Like,
I
"My gut's
know.
fine." And it's like,
Mhm.
"Well, you know, but these things could be just" I'm using an analogy here, but feeding your inflammatory
Yeah.
response, which it could be like a scale of 1 to 10, it could be like a 2 or
Yes.
3, which is normal, and then you're at like an
Yes.
8 because of inflammatory. Is that something you see a lot of times is like outside of the gut issues being solved
Yes.
once you start to fix the gut?
Absolutely. I just actually did a conference in Vegas this year that was all about kind of like more so physical gains and changes and things, and talking about how the gut can impact everything from, right, like our fat tissue breakup, right, to like adipose tissue in the belly, to putting muscle on, to men and their prostate health. Like
Mm,
we talked about all of it, but it depends. Men tend, in my opinion, sorry, men tend to typically be not as in tune with their body,
yeah,
right? Or think that's normal. I've had this my whole life. And some women can get almost that negative concept of like they're too in tune with their body, but maybe they're just a little bit more in tune, in tune with their symptoms and their hormones and their gut. But I do think it's not just you. I see that with men a lot.
well, I wanna reinforce that because personally, I thought it would literally, this is gonna be sound like the silliest thing for someone to hear someone say, but I was is 13, 14 years ago, and I thought it was normal to literally be crippled over in pain after a meal.
Yeah.
And I've never really not for any other reason, I just never really enjoyed
Hmm.
alcohol, just never really got into it, but
Hmm.
one of the things was like, "Hey, pizza and have a beer or 2," like nothing
Yeah.
crazy for
Yeah.
football. And I'll never forget my wife, I don't remember if we were dating at the time or married, and she's like, "That's not normal." And I'm like,
Yeah.
"What?" I just like, I literally couldn't move.
Yeah.
Short along fast forward, of course, there's a bunch of other junk that I shouldn't have had
Hmm.
in my body with that food, but I found out I had a high, food sensitivity.
Yeah.
Primarily, I think it was gluten. I'm trying to remember, there was something else that was high on, like, a test I did. I worked at a health club that we started to implement some of these testing. It was super new, at least
Hmm.
I think newer to the field, but, anyway, short along, like I got rid of that, was like, oh, this
Yeah.
is how I'm supposed to feel. And it was just
Yep.
incredible. But yeah, you're talking, around a bunch of other dudes, like, for watching football, like no one's raising their hand saying, hey man, you should get that checked. Like
I know.
everyone's just like
Everyone's
laying
tracking
there
their
in pain.
antacids together or their PPIs, and they're thinking like,
Yes.
well, it's fine as long as I take my pill. You sound like my husband when we started dating. Same thing. You'd lay up every night with like a chronic clearing of the throat and
Yes.
cough. And it had to be like, this is abnormal. And we did a stool test and we same thing, figured out like beer, gluten, H. pylori, problematic, fix that. Never had to take a PPI again.
Well, I want to come back to the details, but I do want to share one more this anecdotal story. So my
Yeah.
wife, she had like this, and I joke about this. So this is like an inside joke between us, but like she won't take anything, supplements, anything. Like, so she goes through this whole like diagnostic thing and all this stuff, right? And she gets like, you need, here's like the 7 things that are off. I'm like, just start with 1, of course, because she's gonna start with all 7. So anyway, short or long, fast forward the story. The one main thing she stuck with the whole time took care of like 98% of her issues, which was, and I'm not trying to like demonize gluten, it's just a coincidence here, but it was like it was a gluten insensitivity, and there's something else with the liver detoxification, which is separate for optimization. Not, she was still healthy, but it was like, but literally the biggest thing was, she's like, oh my God, sometimes hurt, but it's okay. It was like the joints. She's like, I can't believe how good my joints feel after cut. And then she was like, definitely the type of person, like, don't tell me I can't have something, because then I'm going to want it all the time. So of course she would still have some. And now we're at the point, because this is a few years ago, but now she's at the point where she's like, I'm not having it. It's not worth it. Like instantly I feel that. Like, do you see that a lot with, patients you're working with or clients you're working with?
Yeah, and that's one of the harder things to get people, especially that are on the fence with the more functional, integrative space, is realizing that food can impact your body in ways, right, especially your gut, that you would never think of, or it's hard to buy into, being like your joint pain is related to what you're eating, especially because, right, food sensitivities can essentially take 72 hours to actually mount responses in our body, which what you hear a lot from patients is like, well, I'm pretty much gluten-free. Like I eat it like only once or twice a week. It only takes you eating it like every 4th day to feel like crap 7 days a week if you're that sensitive to it, right? So it's one of the harder humps to get over with people, but it's one of the biggest like life-changing pieces when they can get that right, both their gut and their food.
That's a really good point though, the 72-hour piece, because I've heard that on the positive effect, but I never really went there on the damaging or negative effects, right? If you want to label them that way. That's really interesting, because a lot of times people think of like a slower digesting protein being in your system, or these other, micronutrients being in your system for longer to help and blah, blah, blah. But you don't really often think about, well, I just had that one little thing on Sunday. Now it's Wednesday. It's something else, or Tuesday. Now it must be something else. And it's like, well, no, it's still
Well,
in the
people think
body.
it should be immediate, right? Like I ate it, I feel
Right.
like crap. And it's like, it doesn't always work that way. It can take days. So it's like you eat it, all of a sudden you have acne or hives, like, 24, 48 hours later, you're never going to be like, oh, it was my breakfast, the bagel I ate on Monday. So it does make it hard to be in tune with your body in that way.
Yeah, no, that's good stuff. So I guess like one of the areas I wanted to transition into a little bit is just helping people out there. So, addressing gut health could mean a number of different investments of time, a little bit of money, like if you have to buy testing or coaching or something to fix the gut. So what are like maybe your top, whatever number you have, if it's 3 or 5 kind of signs of like, yeah, you should connect with somebody and do a deeper dive in gut health? Like, what's like that trigger to say, okay, you're at that point where you probably should put a little more of a focus on this?
That's a good question. I don't know if I've been asked that. So I'm going with gut reactions here. So one would be if you're regularly needing to take any type of supplement or medication to kind of minimize, especially like reflux, indigestion,
That's a
change
good
in
one.
bowel. So that might be like a Tums, right? That might be Rolaids. That might be a PPI. If you feel like you need to use those, I'm talking even like monthly, you should be diving into your gut. If you look at your stool tells you so much, and people think it's gross and you shouldn't look at it. But if you see regular outside of whole corn kernels, like if you're seeing food and people are like, oh, well, it's just some nuts and seeds, you should not be having nuts and seeds in your stool or leafy greens. So if you regularly see what looks like food in there. If your stools are not formed, right? If they float to the top of the toilet water, you need to have your gut looked at. If that happens even a couple times a week, you need to talk to somebody, okay?
Mm-hmm.
I would say if you're also maybe not going to the bathroom less than less than every 2 days. So if you're like a more constipated person, even if you're not that bothered by it, if it's every 2 to 3 days or greater, you need to be talking. You need to be talking to somebody. And then I will just say, like, this is a weird, I feel like this is always on social media, but like your stool shouldn't smell. I'm not saying it should smell like roses, but it shouldn't be where you're having to like clear out a bathroom
Right.
and that is like a misconception. People think it's normal, right? Because it's gross, it's stool. But it should not be a thing where you're like sitting there forever, you're wiping forever. Like you should be talking to somebody. And then I'll say fifth, if you have, God, I want to put this at like 10. If you have skin issues that are not going away and you're taking like, Accutane or something for it, I would consider looking at your gut.
Great.
And
So,
thyroid.
and what are maybe I mean, I know we're painting with a broad brush here, so there's nuance, and this is why people do testing, but
Yeah.
what are maybe if we start with like floaters, like what would cause
Yeah.
that, like what would cause, is it?
Yep. Lots of things. So
Could,
when your stool floats, right, it's actually fat malabsorption. So you can
Mhm.
test this on something called like a steatocrit and your pancreatic elastase on a stool test. Your PCP can do this, your GI, or you can do more advanced testing like we were talking about with like a GI map. But essentially, like, you don't digest your food well, your fats, too much fats in there, and then it floats. Almost think of you in a pool back floating, right? Like you float when you have more fat on you. So you shouldn't have fat. Does it happen to the best of us every once in a while? Like you eat high fat food, you get like some GI troubles. Yeah, it's gonna happen every once in a while. But I would think about lots of things. If you don't have a gallbladder or you think possibly you have gallbladder issues, that's a really big contributor for especially females. Okay. I would say like 30 and up, particularly. Um, if you eat really fast and don't give your body actually time to like digest the food downstream, so you're somebody's always eating on the go, you don't chew enough, that can honestly just be a contributor that's happening every once in a while to you. Thyroid health, I think about low stomach acid, which we can talk about, which is a really big contributor. And that's generally infections in the gut, which we could talk about forever, but everything from like parasites to small intestinal bacterial overgrowth, all of those things can basically mess up your bile acids so they don't work well, and then you poop out your fat.
Got it.
So there's
Well,
a lot. We could keep going forever.
yeah, no, for sure. I wanted to walk through a little bit, because you said some really interesting
Mhm,
things there. So one of the things I was curious about is order of operation. And again,
mhm.
for the audience out there, we're painting with a broad brush. There's a lot of nuance, and this is why practitioners get in there. But generally, is phase one, what are the phases? Like, hey, I'm killing bacteria during this phase. I'm growing it
Of
during this
working with the
phase.
gut, you mean?
Yes, yes, yeah, yeah. Like I'm doing
Mhm.
elimination, or I'm killing something off, and
Got
then
it.
I'm adding something here, and then I'm doing this to
Mhm.
optimize it. Like, what is that? Can you give me an
Awesome.
example? And I'm sure there's 70 different examples, but maybe like one
Yeah,
or two more common, dare I say, high level
scenarios.
protocols of how you approach it.
Yeah, so I am a big test don't guess person, but I also understand that there's meaning stool testing and breath testing for small intestinal bacterial overgrowth. Um, I sort of think of the testing piece as more like should be included in some preventative wellness where we're doing that like once a year just to make sure things don't get too, haywire in there. Um, the protocol depends on the situation in the gut, right? So let's just pretend you've done a stool test for all intents and purposes here, but um, depending on how severe something is and symptoms, right? Because sometimes you need to jump in and making people feel better before you can even worry too much about some stuff, right?
Sure.
Get that buy-in a little bit, both for them and for you. Um, I think about the gut immune function. A
Mm,
lot of times, right, let's say infection, let's say H. pylori or something is actually lowering our immune threshold in our gut. We have something called the secretory IgA. I think of it like a bouncer in a club, right? It's always saying like friend or foe, food, infection, like
mm,
should you be here? Should I boot you? Um, but when it gets too low, it's like a cop at the donut shop and off duty, not giving a crap who's coming into your community to protect you. So if somebody's secretory IgA or immune function is on the low end, I like to prime that for like 3 or 4 weeks at least before I go into a kill phase, like you said. If that's not the case, you can absolutely just kind of jump in for a lot of people with trying to eradicate or minimize whatever the overgrowth in the gut is, right? The bad bacteria, the parasite. But I would say generally, like you're priming somebody's gut for a few weeks, keeping that immune support, right? Immunoglobulins, nutrients, colostrum in for a few months. And then alongside that, you can start to put in some like antimicrobial herbs or antibiotic. You can put in gut soothers, leaky gut support if you want. There's this whole concept in the functional space, and people teach it called 4 or 5R program, right? Where it's like remove, replace, reinoculate. I don't really follow that so much because I don't think it's so black and white. I think you have to be like dipping into each thing as you go along, meaning, okay, let's kind of reinoculate some of the good stuff and the gut lining support while removing. And then after, maybe we're reinoculating and keeping some repair support in there. So it's not so black and white, but we definitely talk about specific topics. I'm happy to give more specific.
Yeah, no, I realized I did a poor job of my question. So let me start with, which is a great answer. I mean, you did great because I just gave you this like massive wide question, but let me
get as specific or broad as you want here.
No. I was the one that was way too broad. So let me walk through like H. pylori. So can we start with that? Like, I'm assuming that was the police officer / bouncer in the analogy. If it's low,
that's secretory IgA.
Secretory IgA. Okay, so
but H. pylori is a good one.
We'll start with H. pylori first, and then let's get to that one. I guess like, what does that mean? What is it? Common symptoms, and then potential protocols. Again, we're talking wide here.
So H. pylori is awesome to talk about. It's like the thing I love the most in the world for some reason, but it's the most common GI infection people have worldwide. Over 60% of the world carries it in their gut. It's also something that we can pass back and forth via saliva, via intercourse, lots of different ways. So it runs rampant in households, right? So the biggest causes, it causes a lot of things, but that people see is like indigestion, reflux, stomach pain, nausea on an empty stomach, maybe weight loss, a lot of histamine, like skin issues. But if you or a loved one's taking like a proton pump inhibitor, an acid reducer, there's a good chance that they have some H. pylori in their gut. So it's a bacteria, primarily lives in your stomach and like at the top of your small intestine. We can talk about testing all that if you want, but essentially this one can be, it's where you hear people take like, triple antibiotic therapy through their doctors, where they're put on a couple different antibiotics and possibly like a bismuth or something. But there's a lot of research out there, and your listeners can look up even successful eradication of H. pylori using over-the-counter products. Really great protocol. It's been shown to be as effective, if not more effective, than antibiotic treatments. And it's using things that everybody pretty much has access to, like chewable Pepto-Bismol, or oil of oregano, certain fiber chains, manuka honey, and they can do this in like a 2 to 4 week period. And so that's not that much, right? It's kind of like a lot of things for a short period of time, and you can have really great outcomes. And once that's gone, if you are at least taking care of where it's coming from, meaning like, did your wife have it? Did your partner have it?
Yeah.
You're pretty good at being able to stave that off. It's not usually like keeps coming back if you treat the root cause, if you will. But that one, I would look up that article. I use pretty much that regimen with as a good jump off point with some nuances. So you could even link that if you wanted in the show notes for people.
Okay.
I have a whole ebook on H. pylori that goes really in detail too on protocol.
Nice.
Yeah.
And then what would someone feel like? You said 2 to 4 weeks, so I'm at week 3 or week 4, and I'm about to stop. Like, what would I feel different to know? Like, I think I'm good. Yeah.
So most people, if H. pylori really is the driver and they're tolerating, if the products are the right products for them, they're not having some big like stomach pain issue, actually notice pretty quickly. Like within a week, you'll notice a couple days, things are already feeling a bit better. You have reduced reflux, reduced, indigestion, stomach pain, bowels might be a little bit more formed. After a few weeks, you should either be like it's kind of hard because, right, sometimes H. pylori is not a standalone infection. So it's like there are
Gotcha.
other things at play. But if it's just H. pylori, you'll probably feel 80 to 90% better or more within like a 3 to 4 week period. And so at that point, you can either test yourself again a couple weeks later to see if it's gone, or just sort of move on with your life, you know?
And is
H.
it
pylori is interesting. Sorry, not to cut you off,
yeah, you're
because
fine.
so many people think you need to fully eradicate it. And I'm not in that, camp of belief. I really think it's about minimizing the level so that our immune system can tolerate it in a homeostatic level a little bit better.
Got it. And then is it more common in certain people? Is there a certain genome or certain, way their
Yeah.
gut operates? In other words, once they do fix it, does it persist to come back more in the same person versus someone who doesn't have it? Is there any is that
Yeah, not necessarily that I've seen, at least in the research of a specific, genome or type of person. It's more, let's say, someone's food hygiene, right? Or travel, even. Like if there's somebody who travels for work and they go to third world countries a lot, you can get it while you're eating food out, right? If somebody doesn't wash their hands well, if you're not fixing it within the house. So let's say a husband's taking a PPI because, sorry to make it be the husband, but a PPI because he always has reflux, but he's unwilling to test or do anything. And the
mm,
wife is having thyroid issues, but we uncover H. pylori and treat her. She's probably just going to get it back
just gonna get
from the
back? Yeah.
husband. And that's why the recurrence is so high. And then I'll say the people who have the low immune function in the gut are going to be more likely for it to overgrow again
Got
if
it.
they don't
Okay.
correct that.
Got it. And then the second one you mentioned,
Hmm.
which was the bouncer. I'm drawing a blank now.
It's called,
I've
I know it's a hard one, secretory IgA. Just
secretary
say
IGI.
IgA marker.
Yeah, can you walk us through that and
Yeah.
kinda how that works?
Yeah. So again, right, like think police system in your gut. Is it like protecting you, or is it for taking a break at the coffee shop and not actually on call doing anything? So when it's high, it's not ideal, but it's much better because at least it's like revved up, ready to fight the fight, right, for you
Mm,
in the gut. When it's low, it's like it doesn't give a crap what's going on. It's not ready or energetic to fight for you to clear out infections, clear out food and toxins. So it's really important. Like that to me is the most important marker on a stool test. It
mhm,
really tells so much more. It's also really important for our respiratory health, which just think of how much respiratory issues have been going on for the last, 6 years here. So you can test that, you can support it. Things like vitamin A, zinc, colostrum, probiotics, fish oil, vitamin D. I really love immunoglobulins. Like you can take those on a sort of ongoing basis to
mhm.
support your immune system. But really, when it comes down to it, like food sensitivities and infections in the gut are like the two biggest things that are going to exacerbate that to be low.
Got it, got it. And then I think I mean, there's plenty more, so feel free to add,
Hmm.
but the one I did wanna talk about that we get a lot of questions is, SIBO and
Yes. Yeah.
what does that even mean?
Yeah.
Walk us
Yep.
through that one, please.
So SIBO, SIBO, small intestinal bacterial overgrowth, really causes like 60 to 80% of irritable bowel syndrome. So think, right, change in diarrhea, constipation, bloating, poor stools, essentially IBS. I call it a party on the rooftop when it should be in the basement, right?
Mm,
So generally speaking, when we refer to the microbiome, we're thinking primarily the large intestine, your colon. That's where trillions of bacteria should be, right? That we're aware of at this time. The small intestine should be fairly sterile. We shouldn't have that much bacteria there. It's really where a lot of absorption of your food and nutrients happens, and a lot of the immune function. So what essentially happens is you start to get this overgrowth of bacteria into the small intestine where it should be sterile, and then those bacteria feed on foods that you're putting in that shouldn't really have a feeding frenzy in that area and cause the byproduct of things like gas, bloating, diarrhea, constipation, skin issues, a lot of leaky gut. So that is a loaded topic, which we teach quite a bit about and have ebooks on that as well. But it's essentially there's three types, right? You have methane, it's now called IMO or intestinal methane overgrowth. There's hydrogen sulfide, and then there's hydrogen. Each type is driven by a different bacteria and is usually
mm,
associated with diarrhea or constipation. And our traditional space really right now hyper focuses on like a low FODMAP diet and antibiotics for like 2 weeks and kind of like giving you it as you flare, if you will. But that is something that relapses for so many people because
Mm,
we're never getting to the root cause, which there's a lot of root causes, but it's mostly a motility problem, right? So, do you have a thyroid problem? Do you have a low stomach acid problem? Are you on a PPI, right? Do you have a history of foodborne illness? Something called post-infectious IBS is a really big cause of that. So, those people usually know. They're like, I got salmonella, 6 years ago, and I've never been the same.
mm,
Um, Thyroid function, there's so many different things. H. pylori can contribute, right? Because if you think how I said mouth to anus, usually it's H. pylori, then SIBO, and then we get down to more of the like overgrowth dysbiotic flora. So if you don't fix the H. pylori, you tend to get like a relapse in SIBO for people.
got it. And then you mentioned a couple times
Mhm.
thyroid. I'm just curious if there's any markers that make you pause in blood work related to thyroid and say, this might be, caused by the gut, or is there any, if not blood
Yeah,
work marker? Okay. Yeah. Let's stop.
yeah.
I'll pause there then.
So we could talk forever on the thyroid. Um, so there's a lot of markers, right? When we talk full thyroid panel, we're thinking about like your TSH, your
Mhm.
total and free T4, total and free T3, reverse T3, and your antibodies. Now, the reason I kind of break it down like that is if your markers all look fine, but your free T3 level, which is your active thyroid hormone, meaning your body can actually utilize that hormone for function,
Mhm.
right? If that's low and everything else looks kind of fairly okay, right, or good, I would think about the gut and the liver. Like, what is going on in terms of those parts of your body that you're unable to properly convert that T4 hormone into your T3 hormone? Okay. If your, let's say all of your hormones look fine, but your antibodies are high, right? Your TPO or your TGAB, I would want to know, make sure what is going on with somebody's gut because the gut is one of the biggest kind of contributors to the development of autoimmunity for thyroid, for really any autoimmunity, but for hypothyroid or Hashimoto's patients.
Mm.
So I would want to check someone's gut and say, okay, are there things in here that are contributing to leaky gut, that are contributing to, a change in my immune response that I can minimize and put the fire out before my hormones actually get affected of my
Mm.
thyroid. So those ones would specifically in the thyroid panel make me think gut, or at least let's check it out.
And is it, um, based on the gut and liver that the T4 conversion to T3 you're finding is,
Mhm.
inhibited or minimized, if you will, based on some issues happening there, and that's kinda why the body's not converting as much to the active T3?
Exactly. So, a majority, not all, but a very big majority of our thyroid produces only T4 or the
Sure.
inactive hormone, right? And so our body has to do the job, which is primarily like liver, kidneys, and gut, of actually converting it into the active form to be used. Um, Problem being, our traditional world isn't checking our T3, right? And just giving more T4, assuming your body's going to convert
Gonna
it.
convert it, yeah.
But that's the problem. We don't know. Is
It's
it
not convert
converting it?
yeah.
Right? Usually that's the thing I see in like infertility and gut issues. Chronic constipation is actually that T3 function.
Yeah, and do you notice a increase in the production? I wanna say, well, I don't wanna say because I'm going way back, but reverse T3, there's a certain percent that's, like, normal. Your body's just gonna convert to reverse T3,
Yeah.
which is the isomer of T3, so it's not really doesn't really
Like
do
a
anything.
flip, the
Is there
different
is
way.
there a higher percentage of reverse T3 being converted in that process because of something in the gut, or
So not everyone, a big portion of people who have that high reverse T3, meaning your T3 that was supposed to be getting converted into right T4 to T3 is getting flipped and put into a reverse T3 state, which I usually say is like slamming on the brakes of the thyroid,
sure.
putting you in this like alternate state of hypothyroidism. Usually that think about like under eating, over exercising, chronic stress can be a big factor there. But I always think about people who are sort of like really underdoing it or really overdoing it in the gym.
Mm, yeah. No, that's a good one. I think that no, that's great because I know we're zooming way in on that. I wanted to transition to what you just mentioned there because that was definitely a topic I want to get into. Is like, just chronic stress, and
Yes.
maybe for the audience out there, I want to get Gosh, there's so much. Let me just ask one question and then I'll try to build off of it. But how does that affect the gut, or
Mhm.
could it manifest in the gut? Because I know some people, like, mentally they're good at handling stress, but physiologically there's other things that
Yeah,
happen and they don't really
yeah,
associate the two because they're like, no, I'm good. Like, so how does that, to
yeah.
reframe my question, like, yeah, how does the chronic
What's the
stress
negative
affect the
impact?
gut health?
I
Yeah.
have this awesome, I wish I could like show it on the screen. I have this awesome infographic I created of like the crazy web of what exactly you're asking. So there's like actually many, many, many things that come from that. But I would say like some of the biggest things to take away is chronic stress, right? If it keeps hitting you, is going to lower that bouncer we talked about in your gut. It's going to lower
Mm,
your secretory IgA, putting you at having a bit harder of a time, right? Both respiratory and GI fighting off infections, right? Which then allows you to get an infection that then it's like this hamster wheel, then lowers that secretory IgA even more. And you just kind of keep going on this like hamster wheel, if you will. Um, Also, it will potentially reduce your stomach acid and digestive capacity, which if you think, okay, we're stressed, we're not, producing the things we need to really digest our food really well, you get these large food molecules that essentially make it from your stomach, which should come really mushed down into the small intestine and large intestine. They come as whole food chunks. So then that bacteria, that fungal growth in our gut that should actually be there, has a feeding frenzy and it starts to
mm,
multiply and overgrow, cause symptoms, cause increased things like lipopolysaccharides that cause leaky gut. And it also can cause nutrient deficiencies. Like if you do that and you get more, let's say you have SIBO a little bit going on and you have low stomach acid function and you get these large food molecules that bacteria feed on it, it eats things up like iron, B12, right? And all these different nutrients in your body. So you can get like this low level anemia. You're wondering
mm.
why you feel like crap. It's really happening because of that, right? So it gets like this complicated web. We could talk about that forever, honestly.
No, that's really interesting. So,
And
um,
it can take right? It could take years to
like,
develop, or it can be
build
really
up.
short-lived for people.
Now, do you see that with someone who goes through, like, maybe a traumatic event or maybe
Mhm.
just a tough time in life? And when I say that, I mean it could be like a unexpected job change, maybe death in
Yeah,
a family, maybe divorce.
yeah.
Do you see people coming in, whether it be months, a year or two later, what have you, but it's just like you can kind of point back to that time in life, and that's
Mhm.
what drove the gut a little wacky?
Yes, and it's, the
That's my
hard
that's my
like,
medical term, by the
oftentimes
way. I just wanna be just
a
for
little
everybody out there,
wacky.
a little wacky is a
A little wacky.
clinical term that
I
us
see it.
practitioners use. No.
I know that it is kind of what we um, I see it all of the time. I mean, people with high stress jobs, I have a lot of like trial lawyers, right? I have a
Mm,
lot of people who are like in the police force, in the Navy and different things where it's like very high stress and you see that whether it's momentarily or situationally like drive things for them. The problem with a lot of those situations is that we can identify that got you into the situation, and removing or minimizing that stress can help a lot, but a lot of that groundwork has already been laid where now we have that dysbiotic imbalance in our
yeah.
gut and it's just like a crapshoot in there and we actually have to go in with therapies to correct it. Because let's say you had a little H pylori, it was okay, you can live with it. You got super stressed for 4 months, now the H. pylori is super overgrown. Well, just removing your stress is probably not going to minimize that H. pylori. We now need to use botanicals or something to reduce the level. So that's where it gets kind of like not
Well,
multifactorial.
no, I think it's a great point because, mental health practitioners certainly have their place when you're going through a tough time in
Yeah.
life, but I think a lot of people, which is great if people are, because first, people
Hmm.
are often not willing to even take that step, but let's say they are,
Yeah.
they do get that help, awesome. But
Yeah.
to your point, a lot of the, you know, uh, cellular level, a lot of the
Hmm.
responses in the body are still there. So you still have
Yeah.
these issues there. Well, although you're mentally maybe a little better, you probably could even
Yeah.
be even more better if I'm hearing you correctly, if they
Yeah.
also corrected some of those other areas. Is that fair to say?
Absolutely. It's like dropping something and saying, okay, I sweeped it all up, but now I probably have to mop, right?
Right.
So it's absolutely true. It doesn't mean it's going to hold true for everybody, right? Handling stress can fix a lot, and handling the food can fix a lot, but sometimes you have to dive deeper.
Got it. One of the things that comes up a lot that I want to try to frame this the best I can here for the audience out there, but like gut dysbiosis or some,
Hmm.
a explaining what that means, and then I would like to kind of navigate through Well, let me just pause there. So can you explain what that
What's
means
gut
in
day?
Wasty? Yeah. Yeah. Because
Yes.
I get excited. I got a whole list of stuff.
I
So
know, I know. I love, that's like my favorite thing, like to shoot them at me. I like that. So gut dysbiosis is just like a fancy way of saying an imbalance of good and bad bacteria. I think it gets thrown around a lot. But essentially it's just saying like the good isn't good enough and the bad's too much, right?
yeah, it's just like just pick the long, cool sounding word and you sound
Yeah.
smart automatically,
Yeah.
right? So if we
Yeah.
just use that,
Not everyone's a great educator, remember?
there you go. There you go.
You like to
Um,
sound smart.
Yeah, no, and I was curious too, because like you see so many people, and again, I'm going to assume everyone's well
Mhm.
intentioned, but what are some problematic issues with? I'm just going to go out and just buy this probiotic, or I'm going to buy this
Yeah.
one, or that one, or that one.
Yeah.
Like, can you explain to people out there why that might not be a good move to
Yeah.
do as their first step?
Yeah, so probiotics are probably the most benign thing you could have thrown out as the example because, like, probably not a bunch of harm's going to happen for
Okay,
most people, right? But is it going to be effective? No, you might just have super expensive stool at that point. So, probiotic, very general topic. There's specific strains that help with specific things. I like to categorize it into three kind of probiotic topics. There's something called Aspergillosis, which is not going to be something that you hear commonly recommended or you get that's super helpful for things like that secretory IgA or fungal growth, right?
okay,
H. pylori. Um, or if you had antibiotic use, like that can be something you want to be using. Then there's things like lacto blends, which is what most people think of when they're thinking of a probiotic. That's most over the counter that has your lacto kind of blends. And then there's something called spore based, right? Spore based is going to be a lot of people know like Megaspore, right? Megaspore biotic and stuff like that. I don't love people just jumping on spore base because if your immune function isn't great, if you have a lot of permeability in your gut, like that could potentially trigger a weakened immune system to not be so great for somebody,
mm,
right? So there are negative consequences potentially for people. Aspergillosis, same thing. You can actually cause overgrowth of Aspergillosis in your own body. Um, so it's good to know what you're working with. It's good to know what the research says for your specific situation. I do think we're not in a great place. Like a lot of people are like, oh, you have to test your gut to figure out the right one. I don't even think our testing is there to say this is
it's
what's going to work.
perfect.
Sometimes, yeah, yeah, it's not there.
What are some methodologies or things over the counter you see that could be is there anything that could be
Yeah,
problematic? Like someone just
yeah.
grabs it because they're like, oh, I saw this.
Oh my God. Can we talk about like parasite cleansing?
Sure, let's go.
People, it's all the rage. Oh my gosh. No, people who follow people on social media, follow doctors, follow blogs, and people, I always love to say it's like some of it always holds true, but context matters in everything we talk about in healthcare, right? And people love to say, oh, like my neighbor did this, or this social media influencer or doctor is saying, like, oh, berberine is, nature's metformin or Ozempic, and it can help with your gut. So people put themselves on these antimicrobials long term, not realizing like just because it's a more natural thing doesn't mean it can't eradicate the good stuff too, right? So people put themselves on oil of oregano that's pretty good for everything, and they'll do it for long-term periods, like I'm talking a year. Then they come up and end up in my office and I'm like, what are you doing? You just totally like obliterated your gut like you were taking the antibiotic for a year.
Mm.
So we have to be very intentional with our uses of certain things, and following the advice without any testing or any guidance from somebody who really knows what they're talking about is really poor. I would really say, like, please don't. I understand not everyone can afford everything, but that's
Right.
that's literally why I came out with things like all these really inexpensive ebooks, because people just follow things, have no idea what they're talking about. So antimicrobial herbs, which means things like oregano, berberine, garlic, neem, like anything that kills something, don't just take it.
That's really interesting because like the light bulb went off because I knew it, but I honestly can say, and again, I'm not necessarily a hands-on practitioner as
Mhm.
much anymore, but berberine and its effects with,
Mhm.
blood glucose improvement, things of that nature. I didn't really
Yeah.
think of the antimicrobial part of it as you're mentioning
Yeah.
that. And
I do rotation for people. I'll do like 3 weeks on, 1 week off, or like 3
ah,
and 2, because you need to give the gut a minute, right?
that's really interesting because a lot of people, not a lot, but I've had some people that tell me like berberine gives them an issue with their gut, and I'm just like, I was like, I'd never.
Kills
It was
things.
more like family and friends I was helping, and not that
Yeah.
I'm a bad person, don't wanna help them more. I just didn't really dive into it yet, but it was on my list of topics, and now that you said that, that's why a
Yeah.
light bulb went off because 'cause I'm fortunate enough to where I have a few family members that just have, like, the worst history with gut. It's just like everything that it says can cause this issue, it does. And so that's really something. That's a good takeaway, because I like the rotation thing. Does this, if someone's sensitive to berberine, does that subside a lot when you rotate it that way? Or is it might just be like, hey, this
they might need lower doses. They might need to be doing lower doses, or it's just not the right product for them, which happens, not everything's for everyone. There's other options.
That's tough too, because a lot of the berberine based studies, show like taking it with something that lowers the breakdown of it, and then super high dosages of than what you'd see at like your Walgreens, general bottle is usually much more effective in regards to the reason why most people are taking it, from what I've seen at least. So it's got to be a challenge. That's a challenge too. So that makes a lot of sense.
Yeah. Can I throw two other random things out there that
absolutely.
are not
Go right ahead.
necessarily always gut specific, but I see a lot of people put themselves on and not know like repercussions. So one would be a binder, people putting like GI detox or some kind of binder for toxins or to help them with their gut, and they go on it, and they have a time and a place. So binder just means it's binding out toxins and different things and kill off protocols to like get it out of your body. It pulls everything, right? It pulls nutrients, it pulls medications. So people aren't educated on how to use it. So they take it like 3 times a day. They don't separate it from their meds. So they mess up their medications, they mess up their other supplements, or they end up developing nutrient deficiencies and causing other issues from that. That can also impact your gut, right? Or your whole body. And the other is NAC. You see a lot of people put themselves or patients on NAC. I love NAC. But there's research on this, and I remember it's always kind of that like it's a possibility, you need to be aware. But NAC is a mucolytic, meaning it breaks down and degrades mucus, right? Which is why we use it during like COVID. We use it during like GI or respiratory issues. It helps break apart mucus. Your entire GI tract is mucus, right? It should be healthy layers of mucus to have a healthy non-leaky gut situation and immune function. If you're long-term taking NAC without breaks and you can't figure out why you can't get rid of your leaky gut or different things, you need to think, is it possibly the NAC? So that's what I see a lot of people and practitioners use on people.
I could literally keep you on for 3 hours, but I won't. But it's going to turn into like a Joe Rogan episode. Thank you. Because I was going to say, everyone heard it. It's on recording it. You'll come back. So we're going to do a roundtable for sure, 100%. But I did selfishly, if you have a couple more minutes, I want to ask you, hopefully only one more question, but we'll see.
Go ahead.
What about digestive enzymes? And there's a lot of different types, and things I'm sure that you're way more expertise than mine. But is there any harm to them? Is there a time like do not ever use these? What's the tell us a little bit about that?
Yeah. So we say digestive enzyme, which I mean one specific thing sort of, but I'm going to break it down one step further if you don't mind. So there's 3 parts to a potential enzyme. It's going to be betaine hydrochloric acid, which is kind of an external exogenous source of stomach acid, what we should already be producing endogenously, which a lot of people have an issue with. Then we have our, pancreatic digestive enzymes, which we think about helping to break down, more small and large intestine of like fats, proteins, carbs. BTH cells can do just proteins mostly. And then we have, usually there might be like an ox bile or something in there. And that's more for bile and fat, emulsification and digestion. Not a lot of them come with all 3. A lot of people don't need all 3, right? And are going to have issues with one of those 3 potentially. You can take them separate, which I prefer for a lot of people, because then we can figure out what you actually need. What I will say is that hydrochloric acid, so that betaine HCl, is going to be the number 1 component that's going to cause a problem for somebody.
Okay.
People read, it's similar again. People read something, practitioners, low stomach acid, hydrochloric acid can fix it. And then people don't know anything because there's 0 context to the Instagram post. They start it. Maybe they have, they're on a PPI. This happens all the time. They're on a proton pump inhibitor like omeprazole, right? Prilosec. That medication is intended, which we could talk for 5 hours on, but like intended to shut down somebody's stomach acid production so that they don't have repeat reflux coming up. Now we are on this med and we take the opposite and we're putting stomach acid directly into that situation, right? you should never be taking it if you're on this medication. We should get you off this medication. And that's the issue if we want. But that happens all of the time. So yeah, if that person, let's say, is taking the PPI because they have Barrett's esophagus, you're putting that person at increased risk of esophageal cancer. We could talk literally about stomach acid forever. I'll just jump into that. So enzymes, the pancreatic ones, usually won't cause harm for most people, but I do find a lot of times they actually cause more gas and bloating for people. So you're taking it to help digest, but like a lot of times if we fix that stomach acid piece, we don't actually need more supplements.
That makes sense, because I have a family member that was using pancreatic enzymes, and then we had digestive enzymes, and it was, someone that was working. It was one of those situations where they weren't going to listen to me. They're talking to someone else, and like, I'm sure your husband could resonate with her.
He at least listens, but everyone else in my whole extended family are like, they ask, but then they kind of do.
They don't do it. So I didn't really dive into it, but that makes a lot of sense. So at least the pancreatic enzyme makes that little gas and bloating, but it's not really going to cause an issue. Are there any of them? This may be a really, I'll just ask it. Are any of them better application if someone's having a hard time processing a specific food? And I want to give you an example, like meat. I notice some people will say they want to take a fill in the blank type of enzyme because they're going to have steak, or they're going to have a meatier meal.
Yep. So if it's high protein, we're thinking about adding in betaine hydrochloric acid with pepsin.
Okay.
And maybe, depending for the person, some ox bile to help with the fat if it's a steak specifically. But mostly betaine HCl, right? If they have no gallbladder or history of gallbladder issues, we're thinking about like ox bile and different, TUDCA, taurine, stuff like that. If they have SIBO, you might be thinking about the enzymes for the brush border, right? So there's different enzymes that help where the bacteria of SIBO is in the small intestine. So you're having like an impairment to that digestion. And then there's enzymes that are specific to things like gluten. So people with gluten sensitivity, you can actually get enzymes that help break down like gluten or casein of dairy that are much more effective than using like a broad spectrum type of enzyme.
Awesome.
There's a lot. See, that's why you don't just take things over the counter that people talk about.
No, I mean, so let's do this. So everybody out there, not only your Instagram, but your website and ebooks, it will hopefully you guys will be seeing more of Katie. But can you just tell everyone where to find your information? I mean, like you mentioned, it's a lot of free content on your Instagram, and then you have like ebooks that are,
a podcast. I got a lot of things out there that are free or inexpensive.
Yeah, tell us about what you have going on.
So you can find a majority of stuff on my website. So gut, G-U-T, honest, like the God Honest Truth, guthonesttruth.com. Just use the upper tabs. We have everything from a lot of very detailed blogs to very detailed podcasts sort of like this and asking those specific questions. I have a lot of really great inexpensive ebooks and guides for patients. But you can also find, if you're a practitioner, you're like, I want to learn more of the stuff like we're talking about, or even further into it. We have everything from inexpensive guides to lab and protocol guides to bigger courses that you can do and kind of figure out everything you need to know in there, including private mentoring if you're interested. So you can find it all there. You can follow me. I'm very active on Instagram, so at Gut Honest Truth. And you can find me, everything is Gut Honest Truth. Find me on
definitely.
Spotify, all of it.
I can't stress enough to everyone out there. Definitely give her a follow. Check it out. You'll be seeing for the first optimal people, you'll be seeing her stuff in a couple different areas. So thank you so much for coming on. We really appreciate you coming on. And like I said, I could easily make this like a 3-hour thing. We'd probably just be scratching the surface. So
I know. It's like a month-long podcast episode.
Good stuff. Well, thanks again. And everybody, thanks for tuning in. Be sure to like, comment, share the episode, and definitely check out Katie and all of her contact info. A lot of just wealth of knowledge, but it's all good sound, good quality knowledge, as we always do our best to vet our guest and bring you nothing but the best here at the First Optimal Podcast. So we'll see you guys.